All right. Well, it may just be this crew. And like I said, we do have our parents here with us in spirit. And I'd like to point out that in the wellness survey, I did ask if people were interested in being involved in SHAC, and I had 5 parents give me their contact information. So they best watch out because I'm going to sign him up and that'll be great. I don't think anyone needs to be introduced in this group right now. We all work together. Unless we feel like there's someone who doesn't know, I think we're good. I think we're good. Um, all right. Well, I'm gonna go ahead and share my screen then, and we will all dive into this hurriedly put together presentation of information from the wellness survey. I will also be taking notes on our SHAC minutes. So anything that you share in here, I'll be able to take down some information. Let me see, there it is, share screen. And I know that Miss U has got to bug out early too. So I did put mental health at the end. Why did I do that? It's okay.
Not
You put
not
together.
anymore. Not
Oh no,
anymore.
not anymore.
No,
Okay.
you're stuck
All
with me the
right.
whole time now.
Yay. That's great. And there we
I
go.
am SJ going to jump out right at 12.
Yes. Okie dokie. Then I'm going to fly through this part. But look at Nurse Hernandez. Yay, we celebrated her for School Nurse Day. She is a great model. These are all recent photos of things that had to do with school health. We got our friend here holding his giant carrot over at the community garden, and our wonderful food service ladies that we celebrated for School Lunch Hero Day. So we all know each other unless someone else has joined and I haven't seen it. A quick reminder on what SHAC is. We are a district level committee that assists in ensuring the local community health values are reflected in our health education instruction. We're going to work on making sure that it's a voice for parents in the community, which is one of the reasons why we did the survey. And we help make health related curriculum decisions and health related topics because we believe that healthy kids make a better world and make a better school. We are always looking at how we can align things with the whole school, whole community, whole child model, which includes a lot of different topics, which is why everybody on this call is here because it involves employee wellness and family engagement and our physical environment and health services and our food and all of those things help make a healthy, safe, supported place for our kids to be and our employees to be because I think that it all ties together. Dr. Alyssa Newman will join us whenever she wants to because she's the boss. So maybe we'll come back to her later. So update, our wellness policy was approved at the April board meeting. Thank you all for your edits and for looking that over. It's recently been shared with all families via ParentSquare and is on our website. So those are all required. We have to send it out to everyone and then get feedback on it. And so the next step and kind of what we're going to go over today is creating, it's technically a 3-year wellness plan, but it's really just like goals that follow underneath this policy. Like the policy covers nutrition and physical education. It covers staff wellness, which I don't even have in here because that needs to really kind of be a separate survey. It covers mental health now that we've updated it. So, like, what are some goals that we can have that become our plan so that when we have SHAC meetings, we're talking about like how are we meeting the goals that we've set based on our policy. That is actually what SHACs are supposed to do. And we haven't had like really clear plans since I've been here anyways. So we're gonna try to build that because that's where the policy helps us build the plan. And part of that was getting some feedback. April Strickland, I see you're joining. Thank you, ma'am. Yay. Parent and a community partner in health. We appreciate you. So, recent health and wellness survey. I put this together and then like failed to send it out immediately, but I'm still really pleased that we had 39 respondents. Because if you think about that as like what's the survey word? Like a small part of our whole, that's actually a pretty good response rate. It's not everybody, but it was over a wide variety of campuses. So I feel like it's a good starting spot. The survey covered everything from our wellness policy. I used Google Gemini to help me write some questions um, for the wellness policy, specifically general wellness feedback, communication, nutrition, physical activity, and mental health. So those results, I've kind of done my best to quickly um, condense into some high level topics just to go over. And then I want to hear from each of you for different areas that you have that you're like, hey, these are things that I would love to see us do. I'm going to take all those notes and try to work on the basis of a plan that I will bring back to SHAC at the beginning of next school year. But right now, while we're in the mental place, it's a little easier to say, oh, here's what I'd like to see for next year versus coming in August and being like, whoa, summer just happened. I don't know what the plan is. So I'm hoping to take the information now and synthesize that so that we have a plan when we start next year. Um, so of that, it was 69% parent guardian, 28% staff teacher and teachers staff who are also parents. We didn't have any specifically community people fill it out, but I'm hoping to kind of leave it open and get some more feedback because this was a short like, hey, please fill this out. I sure hope someone fills it out before a SHAC meeting. But the questions are still valid, so hopefully it's something that we could use year over year to see if we're improving as well, because the questions are very specific to the policy that we have. And then is the campus breakdown, which is again like a pretty good representation across campuses. And I don't have a student rep report or staff members who don't have kids here. And so I just went through and kind of put together like the percentages of positive versus negative responses and some specific, there were open-ended questions where parents and staff could give specific like, hey, I feel like this needs to change, or and some of them were like one person and some of them were several people saying the same thing. So on the wellness communication overall, it's pretty positive, is around a 4, and it's a 1 to 5 scale, 5 being amazing, there's nothing you can do better. So the what I'm most encouraged by was that the wellness policy, does the wellness policy align with your family's wellness goals? The average response was even more than that. It was more of a 4. So that means like we're on track as far as like what families like. It was linked to the policy. You can go look at the policy. So I felt like that was really good. The saying that we're kind of on track with what our families want, which is the point of SHAC, is to try to reflect our community's values in what we're doing. And then I had a long list of things like what would you like to have communicated to you more? The top things were stress management for students, positive mental health resources for use at home, more info on things like flu and dental clinics, and community health resources and preventative healthcare information. So things like vaccinations, and things like that. That was what was listed, which is great because Nurse Hernandez and I we're gonna communicate with them about that. We were just talking about it yesterday. So all really good information and some things that we're already doing with our counselor connection newsletter, and something that maybe we can just continue to push out to families. So top priorities for school wellness that bubbled up specifically were nutrition and food quality and mental health. So this is a synthesis of all of the parent responses. So a strong focus was placed on improving the food environment, including providing healthy options and prioritizing feeding students, which we have a whole nother slide on, and ensuring the food is appealing to students, potentially with student input, which is something that Chef Nate wants to do. Improving menu selection and addressing issues like childhood obesity. So those were all very specifically, and several people said that. And then on the mental health side, and this is before they even got to the mental health section, looking at mental health support and education, including reducing anxiety, information on eating disorders, and teaching about signs and symptoms of mental and physical illness. There was one that was I thought was really great, maybe more timely, and I don't have all of the quotes. I'm going to put together a report and send it to you that has all the rest of the details in it. But one was like timely notification of like sickness in specific classes, like elementary, like, hey, we have an outbreak of flu. But like it doesn't have to be everybody, like with parents where you can just message fourth grade and say, hey, fourth grade is seeing flu cases, like wash your hands and be aware. Like in a way that doesn't call anybody out. But I thought that was an interesting like symptoms of illness, like being aware of even things that are very hyper specific to campuses instead of it being a huge general thing that gets ignored. Um, and again, the same with mental health. There may be specific mental health things that are more prevalent at specific age groups where they get maybe a more specific communication just to eighth and ninth grade or something like that versus like just like obviously test anxiety is the whole thing. But it was just an idea of like a suggestion from a parent of saying like, hey, if it's really specific to my kid, I'm more likely to read it. So I thought that was helpful. Um, Education information. They say they want more education about making healthy food choices for their family, basic nutrition, and understanding, again, health conditions, physical and mental. Physical activity, one response specifically talked about reducing sedentary time in after school programs, stating that there's a lot of sitting. I know that they do play a lot when the weather is nice, but there are days when the weather is not. So increasing opportunities for physical activity, maybe an after school walking or running club. Coach Woody, I did not tell them this. We were talking about this yesterday. That is a straight parent feedback. After school running club. And then just mentioning more timely, effective reminders in case communication is missed initially. So like maybe like another nudge on things. Sending it once is never enough when it comes to like communicating broadly to people. So they're asking for education and more communication. Let's go. All right, so top nutrition section was 64% neutral to negative, which we know it's not the highest rated currently, but 55% believe that the school does promote healthy eating habits. We are providing fruits and vegetable options every single day in our meals at breakfast and lunch. Um, the top concern, and I chatted with Chef Nate about this earlier, was palatability and student acceptance. So like providing food that doesn't get eaten means kids are hungry. They throw things away. There's a lot of food waste. So a lot of the parent feedback was about healthy food efforts, but making sure that they're the healthy food that our kids will eat. Prioritizing, ensuring that they're eating and balancing that. Balancing like what, and it says nutritional goals, but really it's balancing what's the requirements are with what our kids will eat. And I know Chef Nate's going to talk about that in a bit, but this is just our feedback. Um, Improved food quality ingredients. There was a lot of responses about less processed food, more fresh ingredients, which has already been an effort that you're doing, providing whole apples instead of sliced apples in bags. Let's go. Um, because you know how it is, apples get mealy and weird like in less than 24 hours when I pack them in lunches. Um, Specifically requesting less canned vegetables if possible, more scratch type cooking, and fewer fried or prepackaged items. Um, Again, fresh vegetables, fresh protein options. And then there were some questions about offering alternative options for students who don't like the main meal of the day. So that's the nutrition section. On physical activity, 64% positive for physical activity as far as how active our kids are throughout the day. The specific feedback on this one was just looking at the variety of activities, whether or not there are other sport options. Again, walking and running club might have been the same parent. Volleyball, golf, aerobic exercise, dance, and cheer, which is something I feel like we're moving towards here at secondary, do it with our spirit squad. And there's certainly an interest at middle school as well for cheer and movement in that area. Other suggestions included summer wellness camps, outdoor education that uses like going to the park when you can. organize physical education instructions that are tailored for students who are not participating in school athletics, which is really important for me because I have kids who are not probably going to be athletes that sit on their rears a lot during PE. And I would love to see that an increased focus on just looking at how do you be a healthy human in your body, because these kids are going to become adults who need to have healthy habits formed as far as like movement's concerned. And it doesn't have to be that you are a basketball star, right? And then a specific request was made for a playground with age appropriate equipment for older students. Our middle schoolers have a field. So I actually had a really cool Baylor group from the public health master's degree program pulled together a full grant proposal on specifically our middle schoolers, creating a program to engage with them and to request specific equipment like a gaga ball pit, a tether ball, and a few other things. So I'm going to send that out with our SHAC notes. It's really cool. It's called Rise and Soar with the Ravens. And it has all these cool community involvement activities for engaging kids, keeping them from sitting during like break times and stuff like that, having things to do, especially if you're not specifically sports oriented. And our board president, Emily Cunningham, is the one who connected me with the Baylor class, and she is going to be working on looking for funding this summer using the grant proposal because it's like 60 pages of in-depth research that we didn't have to do. So it's really great, and it feels like it fits our school a lot. So I was really encouraged by reading that. They also did one for our pre-K through first grade campus that was involved with kind of revamping their playground area and increasing the turf, and working on a cool thing that helps them track mileage and getting the kids out running laps and tracking things. So that's on physical activity. Mental health, 64% positive, and 84% read the monthly counselor connection, which is huge, huge, you guys. Thank you, Miss Lopez and Miss Ugalano. That is big. That is big.
Yay.
We can have a nurse's notes too, Miss Hernandez. We can combine them if you want to put in some reminders to stay healthy. And so other specific feedback were targeting needs like grief and anxiety, for those students who feel that those things come up. There's certainly different times where we go through grief and we have more anxious times. Parents see the need for increased awareness and education, more developmentally specific and preventative training for staff, parents, and students. So I could see having a mental health night or things like that where we get people. Again, I'm very excited about having the gym, maybe a place to gather another district-wide group where we have a mental health fair or something like that, and making that really specific to the developmental ages. And that was the majority of it. That was the survey. So, okay, great. And Dr. Newman is about to log in and talk to us. And then what I want to hear from you guys, because I just talked a whole bunch, were some ideas that you have. Counselors have sent me some great goals. Our food service director, Nate's here. So he's got some goals because this is our parent feedback. But I know that all of you are super smart and great in your areas, and you have things that you're like, yes, I agree with these parents, and I want to see these 2 or 3 things change. I want to make this a goal for 25, 26. So I just want to take some notes and have us like talk collaboratively about some ideas that can be that form the basis of our plan for wellness. But first, as Newman is logging on, what do y'all think on just the response to this to the survey results so far? I'm gonna open it up.
I'm actually really surprised that we had that much of a response, but I'm glad because it looks like they're pretty in tune with the way we want to move things.
I agree.
I agree with her. I'm excited about the response. You know, any response from me from parents is amazing in my eyes, and being detailed with their response is awesome. I always tell them, how can we get better unless you tell us? Because sometimes when you're on the inside, you don't see things as clear as they can on the outside. So I like the detailed responses that they gave.
Yeah, they're providing the solutions along with the
Mhm.
problems, and that's
It's
awesome.
not just complaining or saying y'all do this all
Yes.
terribly. It's like, hey, I'd like to see this change, or
Yes.
I think that my kid would respond great to having this
Right.
option. Or yeah.
I also think it's great that there was a response or there was representation from across all the campuses and not just, just elementary or just middle or just, high school. It was parents from all over the campuses were able to give some great feedback.
You have any thoughts, Chef Nate? I know I told you I was like, I'm gonna present some results about nutrition and you haven't seen them yet. I'm sorry. Y'all, it's
No,
been busy.
all those responses were great. And like you and I have talked over the weeks, right in line with things I identified as soon as I got here. And I definitely look forward to speaking on it to here in a minute when after Dr. Newman gets rolling. Because I agree 100%. We're definitely going to take it in the direction that's best for the students and what the parents are expecting and what we expect too.
Miss Strickland, were you able to hear all of that? Did you have any
Yeah,
thoughts as a parent and community partner?
y'all like the wheels are turning back here. I guess since you're taking notes from next year, can you hear me okay? I'm in a
I can hear you great.
okay. Um, what if okay, so you know how like even trying to get more parents to come to these SHAC meetings, and I think like a couple SHACs meeting, we talk about like a parent inviting a parent. I don't know if there'd be any way we can incentivize that. I know a lot of people maybe sometimes get excited about certain things. But if we had like families that wanted to share, like, hey, how does like, because I can come in as the BOT agent, right? And do
Mhm.
like a physical activity program, or I can come do a nutrition something or other. But I think it'd be really neat if we could have other families kind of like be guest, like have a role as a guest speaker to share how is your family getting uh more physical activity into their week, or how are y'all getting more nutritious meals? And then maybe they'll be like, hey, I'm going to be on the SHAC meeting for like 5 minutes, like y'all need to like log in and come support. I don't know, but
Oh, I
that's just
love
an
that
idea.
idea. Kind of like what
Yeah.
we did this year where we had staff share, but instead it would be like family sharing like a healthy living balance or a story about something that
Yeah,
they,
because there may
yeah.
be like they share something locally they do. Oh, we go to such and such park, and maybe there's another family on there that didn't even know that park was there or that it had those amenities. So, but just trying to get, I don't know if maybe if families, because I'm like, why aren't there more parents coming to the SHAC meetings? Like how do we ask them why they're not coming? Or like why, I don't know. But anyways, that's just the only other thought I had in mind was like, could we have like them have like a spot, like a 5 minute
Yeah.
commercial or something where, maybe that would, maybe they would be more inclined to invite like, other fifth grade parents or other,
Right.
you know, anyways, that's all I had. Yeah,
Well,
all the
and for this,
numbers.
in the same way, we could do students as well, especially PACS students who are learning a lot about physical
Mhm.
education and nutrition. They might be able to share some things too.
Yeah. But yeah, I think y'all are spot on all the efforts and everything that I've seen. Our family's only been with Rappaport the last 2 years or so, but I mean, y'all really, I admire all of y'all for just the intentionality you have for our families and our kiddos being healthy in all the ways.
Yay, thank you so much. And thank you for coming and doing some programs, even just recently. When do you have before we hop over, do you have one more week that you're coming, or are you done with the walk and talk?
Yeah, I'll be there Monday. Monday will be my
Monday.
last week, and then I'll be Friday at Mac, and then I'll be Monday
Right, I
at
have Friday.
Wood.
Okay. So, will you tell them real quickly what you're doing, and then I'm gonna let Newman talk. Just
Yeah,
gotta wait, Newman.
yeah. So we're doing the program that I'm doing with them I'm doing it with two seventh grade classes with Miss McKenzie and one fifth grade class with Miss Moncio, and it's just a walk and talk. So I have them for that about 45, 50 minutes. We do about 30 minutes of nutrition. So we pick two veggies and two fruits. So like last week we did or like let's say the first week we did zucchini. So we talked about what the nutritional components of zucchini. We talked about it's a green vegetable, so it helps our immune system. We talked about how zucchini grows, how we can actually grow it here in Waco. We talked about how much vegetables we should be eating every day. And then we actually in class made zucchini bread. Like I bought my little mini oven. And they were every week, 2 or 3 different students get to be my sous chefs and they help me. And then the next week, another 3 or 4 kids get to come up and chop and mix and all the things. And then the last 15 or minutes or so is some type of physical activity. So like that week 1, it was raining outside. So we did these, they're called, they're like these dice, but they have different physical activity on each side. So like one of them might say punches or jumping jacks. And so the other dice has a number and it's so funny. They're like, I want to roll next. I want to roll next. And yeah, for like 15 minutes, they're just rolling the dice and whatever it does, we do as a class. And we got some.
Oh, we lost you. Oh no.
Oh no,
I think she's stuck.
the
But
dice must have said to freeze.
the dice are really fun. I have a set at home, and you might end up doing 6 jumping jacks or what have you. So
Yep.
okay. Well, Dr. Newman, we just went over the results of the health and wellness survey, which I'm going to put together a report and send to everyone that has a more in-depth. This was just a real from the top view. A lot of it was positive. A lot of it had a lot of great feedback from families and things that they'd like to see. So, but what I wanted you to come talk to us about is just to kind of re-envision us for like what SHAC is for and how this group makes an impact that matters here at Rappaport. As we're looking at planning our goals and priorities for 25, 26, and really the next 3 years.
Absolutely. So hey, everybody, I think
it's all staff members today.
Yeah,
but I said that our parents are here in spirit because we had about 35 parents fill out the survey. So we are bringing in parent feedback.
Perfect. So we have parents as a part of it. So SHAC committee actually is initially not required for charter schools, which is kind of interesting because this is something that Rappaport Academy has decided is important. We wanted to have a very targeted focus on student health and do it in an advisory way. So we've taken those best practices that are requirements for other places and we've brought them in here to Rappaport. So what SHAC is supposed to do, and I think has done it well in lots of different areas, is they're really supposed to be a guidance place for district policies and initiatives for any sort of health related activities, curriculum, or plans that we do across the district. So initially, the very earliest stages of SHAC, it was really about health curriculum. That was a lot of what we did was which curriculum are we going to use to teach kids about their bodies and what does that look like? And then we had a little bit with the food guidelines. And that was how much do we want to regulate what comes into school and what we have at school and making sure we're following the policy for that. I will say that it has evolved into what it is today, thankfully. It is a place where we can get ideas, we can get feedback, we can talk about parent engagement. I would love for there to be continued conversation about health and wellness in the mental health, physical health, understanding our bodies and curriculum. I would love for there to be continued conversations. Nate and I have talked a lot about the palates of kiddos, what they eat, why it's important, how to get them in a healthy movement. We've also talked some with our staff about what regulating outside food really looks like and how we do a lot of work at places and it sometimes damages relationships between staff and kids. And is that a place where we really want to spend a lot of effort and potentially kind of withdraw from those accounts, those relationship accounts with kids or with families? So I think continuing to press in on guidance for what that looks like, really being a resource for our coaches, for our athletic teams, for our PE teams, for our food service team, but also for our counselors for mental health for Katrina. So being a place where we can bring ideas and we can kind of get feedback on, is this a place that's going to be high leverage? Is it going to change the way kids grow up in life? Is it going to change the way that we can positively impact or engage? Or is it going to change the way that we help people make sure that they are balanced and healthy? as they walk through the school day and then beyond? Are we establishing good practices and habits? And so I think doing things like the surveys, doing things like reviewing our health guidelines, looking at our wellness plan, um, helping us to ask questions on our annual surveys of our staff and our families. Maybe we start injecting some of those questions in that so that every year we're asking, how do you feel? What does it look like? What does school look like for you? I think those would be great places to look for. But again, there's so many, we get lots of feedback in lots of ways. But I think having SHAC be very specifically focused on health, meaning in all those aspects, right? Mental health, physical health, and then the curriculum and tools that we're using to help guide those, I think is going to be really important to continue as we walk forward. Was that kind of
that was
helpful,
great.
SJ? So
I appreciate it.
I definitely see some kind of key areas that I would love some kind of extra press in for. And that is to help Nate as he grows into his role, like he's kind of still into the fire hose part of it, right? So as he grows in, he has a personal passion for healthy eating and expanding kids' palates in his restaurant experience. And so I would love to see like how we can continue to get feedback from kiddos that opens their mind to different cultures and foods, that encourages healthy eating, and that does it in a way that they'll actually consume it. And so that's one of the things that we've talked a lot about is expanding it in a way that is still going to be consumable, but with intentionality. And then I think the flip side is I know it was ramping up pre-COVID, but COVID, post-COVID, the amount of imbalance that we have with eating styles, screen habits, mental health awareness, like that sort of stuff. I would love to see more kind of ideas and intentionality for how we're really helping to support our families and our kids as they move throughout their day and their week and their year. There's also going to be some opportunities with the gym coming online for SHAC to have some updates from athletics, opportunities for our senior level practicum students who are working on their personal certification, personal fitness certification, personal trainer, certification for that, to be able to use that as a lab space. So that's a place where we could build programs for, in our CTE program, we could build programs for kids and staff. So just kind of working in through all of those, I think there's going to be some cool opportunities.
There was a specific quote, I think it was from a staff member that was like, I'm excited about the gym, but I hope it's not only going to be used for the basketball team. Which is, you know, a great point that we need to use that as an opportunity to say that is meant to be something for the entire Rappaport community and for the East Waco community when we're looking at after hours usage and things like that.
So
but
so Brian
it's a fair thing to be concerned about.
So Brian Foreman and I, right, the athletic director, we just met yesterday, and he's got a list of things where he wants to do like staff hours, because we know staff are not going to use it if students are using it at the same time for the workout space. And so he's already thought about like blocking out certain hours for staff to be able to come use the equipment to work out to kind of gain healthy balance. Again, he wants to continue the partnership for the personal trainers, which is part of our practicum capstone on our exercise science classes. We're going to look at that as a lab class for some of the practicum students who are doing their certification. So I think that'll be great. He's already thought about how we can incorporate other outside groups. Like, I don't know if there was maybe a hip hop aerobics class that would want to come teach once a week, potentially, right? Like having those kind of things where people come into the space and use the space for community activities, staff, and students. So I think all that would be great. That may be something in one of your like early fall meetings to have Brian come in and talk about plans. It's not going to happen immediately because we have a lot of agreements we have to put in place and contracts and, you know, that sort of stuff. But that's something that
and systems and keeping the building clean and all of that is going to be
all those things. Yeah,
we're building it while we're flying it.
Yep.
Okay, great. I love that. I will put that down as an option. Hey, Pac, I know you had to go. You're in your car. I wanted to be sure that you had a chance to say some things before you are potentially dangerously talking to us, if you have time. And if not, you can always email me things later.
Absolutely. I can talk and drive. Y'all are hands-free, so it's good.
This is being recorded, just so you know. So if there's something that happens, we will all know. Oh, hang on. Okay, we lost your audio. Oh yeah, we lost our audio. She's talking and I can't hear her. Oh, text her. She's talking passionately. Okay. I bet it's like a Bluetooth thing.
Embed it into our curriculum.
Oh,
Love to get the families engaged, not just learning from us or reading from us. Come up here and let's show you what's going on. Let's give you that information hands on. That's all.
we lost the first like 80% of what you said because I think maybe it was transitioning Wi-Fi from Wi-Fi to data on your
Oh
phone.
man, I just kept on talking too,
You
didn't I?
did. I was like, she is talking and she is passionate, and I don't know what she's saying. I'm sorry.
Like how I want to get the community engaged and do like health events and like a health fair, and we could do like vaccine clinics and have the community clinics come in and do flu shots, and like our curriculums be built around that with CCMA next year, and just add that health component and have like little seminars or something to where it would be more hands-on for the families instead of just shooting out information and saying, here, read this. That's all. I just had a lot to say about a little bitty blurb.
All good. So you're looking at maybe making that a part of your curriculum. Will you say, did you say CC?
CCMA, which is Certified Clinical Medical Assistant.
Which is what you're moving to, or you're offering in addition
next
to?
year, that will be my practicum next year.
Okay. Certified
Clinical Medical Assistant.
Clinical Assistant. Great. So if we have ideas, we can get with you and your students will do some things, huh?
Absolutely.
Love it. Thank you very much, Miss Pack.
Absolutely. Thank y'all so much.
Drive safe. Okay. I know everybody else. I want us to finish on time. So Chef Nate, do you need to go next to get back to what you're doing, or is anybody else like gonna have to leave really fast? Whitty, do you have any ideas or goals that you want to go over if you have to go quickly? I just want to honor the time as far as like people needing to peel off because of stuff. If you have any goals for next year that you'd like to see happen within our school health goals, and I have a nice list from our counselors. I'm holding on to y'all's to last because I already have it.
I'm good on time either way. Whoever
Okay.
is short on time can go first.
I guess the one goal that I had for next year was like maybe collaborating with fourth grade at the beginning of the year. And maybe have some fourth graders demonstrate different scenarios that frequently happen in PE, such as like bad sportsmanship, not sharing equipment, just different scenarios that maybe like fourth grade could like put on a play and like second and third grade is watching, and let's just talk about look how ways that we can resolve this all by ourselves and without it escalating and everybody getting, upset and tears and stomping. And I think it would be good for like fourth grade to have that kind of leadership. And then it's second and third grade to like see it and all the teachers there and we can discuss it. And hopefully students can learn a lot faster on just resolving different situations all by themselves. And we can do this at the beginning of the year when it's like really hot. So like maybe one day a week.
Yeah. Everyone's inside anyways. I love that. So I wrote down collaborating with fourth grade to demonstrate scenarios for helping learn procedures and safety for PE.
Yeah.
Okay. Is there any chance that you can bring Voice back? Did they come this year at all? I know that was a program that you had. Wasn't it Voice, the ones who came in and talked about healthy like choices and
Yes, they didn't come this year. I don't know. We would have to probably have to reach out to them,
okay.
but it was like 10 weeks
Yeah.
and they come once a week and they just discuss various topics. Yeah, like emotions, how to be a good friend, that kind of stuff. And then the kids get a bunch of prizes. I would have
Yeah.
to reach
So
out to them. I don't know if they get booked quickly or how
I
that
I
works.
don't know either, but I was just thinking that that was a really great component for like, especially your days when maybe the weather wasn't nice or things like that, where you could have them facilitate something. It's just an idea. I know that that's not specifically physical education, but it does tie into some of the stuff that we talk about in SHAC as far as like making good choices and like and I think was there anything some about you know drug use or things like that too, maybe again like peer pressure and stuff like that. They talked about
Yes.
those things. Yeah.
Yes.
So that was just one question I had when I think about your campus. I think that was a good program if they're available to come. But I love your idea of having the fourth graders continue to take on leadership. All right. Miss Thomas, do you have any ideas on goals or priorities? You're right next to Woody on my screen, so I'm gonna pop you on there.
No, just listening to the communication part and making sure we're communicating those things. I know Dr. Newman and I have been talking with Dr. Thomas about the dental thing, so hopefully that'll be something that we can add this coming year.
We
Um,
had a dental clinic. It just wasn't super like there was some issues getting all the paperwork back.
yeah,
So we
well,
didn't have as
hopefully, I definitely think that'll be a good thing if we can get it
I
going.
think
Yeah.
starting now to plan put those things on the calendar because if we try to do it once the fall's already here, it's too late.
Yeah, yeah,
I have learned.
yeah. So, yeah, that's my piece.
Thank you. Miss Hernandez, we talked briefly about communicating more with families about vaccinations and things like that, but just from your perspective, jumping in here as school nurse, what are some priorities that you can see being added to our wellness plan?
Um, I think having education come out prior to me getting their screenings done, because I try to get those done in the fall, but I started pretty much at the end of the fall last year, so I was having to get them done in spring. Just so that parents are aware that, hey, we're going to be completing vision, hearing, and then for the appropriate ages, the spinal screenings. That way they're aware ahead of time. So when they're getting these letters home and phone calls like, hey, by the way, your child may need to go have an eye exam done. They're like, what? What are you talking about? Why are you screening them? So just so they're aware a little bit ahead of time and then that kind of have a heads up that those things may be coming.
Love that. I got one of those letters and I was like, what am I supposed to do about this? Like, what do you mean her one side is off balance? Oh
Yeah,
my
I was
God.
like, she never mentioned it, so I hope she took her to the doctor at some point.
I did.
Okay.
She has a order to get a spinal x-ray. So
Okay, perfect.
it just became this whole thing with Providence and the doctor's
Oh,
order wasn't signed. It was just a mess. So
oh.
but
I'm glad you.
education going out to families before
Yes,
screenings.
yes.
Did you have a lot of people who are like, wait, are you allowed to screen my kid for vision and hearing? Or
Well,
like,
I had a lot of parents who were like, "Well, I took them to the doctor 2 years ago, and their eyes were fine." I'm like, "That's a lot of iPad and cell phone usage between then and now, so their eyes
yeah,
may no longer be fine. Please take your child to be screened at the
gotcha.
doctor." So,
Great. Chef Nate.
How's everybody doing? So the feedback on that survey was great, and it was good to see that, knowing that we're, what we've already identified these last handful of weeks, that we're in line with same goals we have to change, implement change. Definitely very passionate about the healthy eating for all of us, especially our kiddos, like Dr. Newman was saying. I have I personally made a commitment when I got here to eat every single thing that our students were eating. And I quickly identified some things that I definitely don't want to see anymore. And I've also noticed that most of that stuff ends up in the trash anyway. So I was sharing with SJ earlier that one of the tables had stopped me yesterday. We're starting to get feedback from the students, and they're actually stopping me time to time, saying that they've seen a little bit of change and they appreciate it. And I've seen them getting excited about, we've been doing the Clementine oranges instead of the little fruit cups that are packaged. So definitely the goal is to get away from the processed foods as much as possible. Still keeping in mind to be state and federal compliant, and also knowing that we do receive supplies from the state that we will have to utilize. So kind of managing that. But next week will be a good tester also. I'm bringing in fresh watermelon, bananas, apples, more clementines. This week, these last 2 weeks, canned vegetables and fruits versus quick fresh frozen vegetables, which obviously keep their color. They don't have all the sodium in them. They just look better to start off with. So, we do everything with our eyes. It's all about presentation. Something over the years in the restaurant world, you could take a plate from a national chain restaurant, use the exact same food and just present it differently, make it look different on the plate, and you're going to see an increase on consumption just because it looks better. Then if you can back that up with better quality and taste and nutrition, then that's a home run. So, and definitely, I hope we can continue to get more feedback from parents and students to keep that going as we see the change. I know the team's excited too. They're looking forward to, I've been getting their feedback as well. They've shared with me that things that they have seen over the year or the years or months that they know the students don't like. It ends up in the trash. So, and it's good to know too, as I'm getting acclimated and learning the child nutrition from the state and federal side, that, the state is encouraging all these things also. So it's not, it's a thing. It's not, we're up against any resistance or anything. Some districts have even went as far enough as they've removed chocolate milk. So chocolate milk is a targeted item with the dilemma of, oh my goodness, chocolate might be the only way to get the kids to consume milk. But there's a big initiative to reduce sugar and sodium in students' diets. And chocolate milk tastes great, but unfortunately has a lot of sugar in it. I don't see that being the case for us. It's just an example, but so definitely on the same mission. So I'm glad to hear that that's on the parents and students' minds as well.
Mm-hmm. That's great. Thank you for that feedback. I've written those goals down. If I pull this tab over, can y'all see this now? I don't know if it's just showing my Canva. Let's see if I exit this. Does it show? I'm trying to put the mental health wellness here. Can you see this Google Doc, y'all? Okay, great. Ms. Lopez and Ms. Yu, would you guys go over the very beautiful goals that you have written here?
Sure. Some of these we are already doing, and there's just areas of improvement. So the first goal is increase staff and parent engagement in student mental health through targeted training, professional development, and consistent communication, such as the newsletters and community resources that we started sending out this year. Goal 2 is implementation of current district-wide behavioral and mental health programs to prevent bullying, promote mental well-being, and support positive behavioral choices. We kind of have those programs already through suicide, bullying, and substance abuse prevention. And then number 3, expand student access to mental health services and resources, ensuring timely support through teletherapy like our T-Chat, access to the campus counselor, district-wide needs assessments, which we haven't done, but I think would be good for us to start doing, and then creating a comprehensive SEL program, and making sure that our referral systems and protocols are clear and efficient for for staff and students. They know how to get a hold of us if they need to.
Love it. Just gonna copy that into my minutes. All right. The only other thing that I had on my list that again wasn't fully covered because it was kind of more a parent survey, but I want to work on a few employee initiatives. So one thing I would like to see if I have the capacity to launch in the fall is the Walk Across Texas Challenge that employees can do, where you can work in teams to just track your steps. We did this at Region 12, and you try to walk the 870 plus miles that is like from one side of Texas to the other. So like you can have an elementary team, a middle school team, the coaches team, or something like that. So collectively you're walking that. It's not like you personally have to walk 800 miles. But if you're logging your steps, it goes towards your team's goal. And I think that might be a fun thing to do. We'll see how much buy-in we get, but I'm going to work on getting some prizes donated. And that's what motivated our groups to do it at Region 12. What do you guys think about something like that, where we do something that's like a district-wide effort for staff to do something wellness-wise? I was thinking maybe Walk Across Texas in the fall, and maybe something specific to mental health and wellness or stress reduction in the spring, because that's when like everything just gets harder. While physical activity can help with that, sometimes like just like focusing on like ideas for stress reduction for staff. Specifically trying to use like maybe using the employee newsletter and some pushes on Parent Square about different wellness initiatives for staff.
I like it.
Anyone have a prediction on who's going to win Walk Across Texas? All
The coaches team, if
the
that's
PE
one.
coaches, everybody's like literally walk all day long. I have to set reminders on my watch to get up and walk, y'all, on some days.
You'll have to break them up. That's not fair.
That's right. Everybody gets one coach. It's like your trump card. That's to win. All right. Well, that was the only other thing on my list, was just like it is a part of our wellness policy that we do something for staff wellness. And so I was just thinking that would be, because it's an existing program, it would be an easy one to implement. So last of all, here's some cute kids. Thank you. Thank you for all the involvement and your feedback, and for coming to these meetings during your lunch break, because your involvement is really vital for making this a healthy place to learn and to work. And I appreciate you all. And these kids appreciate you, and they don't even know it. So appreciate you guys very much. And I will, again, work on finishing up our minutes. I will send you the report from the health survey and that grant proposal that I mentioned from Baylor, if you'd like to peruse through it. I think it's really, really cool. So thank you for your time.
Great
And
job,
SHAC
Parents Day.
2025
Thank
is
you.
done. Bye, guys.